This is Steve Parker again with Elite Therapy Solutions in Richardson, Texas and SportsMedCentral.net. Today we're going to do a stretch for the IT band. Ideally you get warmed up for about 5 minutes before you stretch the IT band. It's this fascia that goes down the outside of the leg and attaches down below the knee. And this is the ideal stretch right here if you can put your hips perpendicular to the table and lower and come to the edge of the table and lower the top leg off the edge of the table. As you can tell, I drew out the IT band and where it inserts down below the knee. Now it's important to get warm because a warm tissue will stretch twice as far as a cold tissue. And when you stretch, you should be a 30-second hold. I like to do it 3 times. Alternating legs from one leg to the other. If you do have IT band tendonitis, it's usually down somewhere close to the knee. And now we're going to talk about how to tape this thing. Now, if we tape it correctly, we'll put pressure above the insertion of the tendon. So I take some Stickum spray. This is Tough Skin here. There's a lot of different ones on the market. You're just going to spray halfway around the leg, and then we're going to use what's called Coverall, Leukotape, and some sharp scissors. Here's the Coverall. It's 4-inch Coverall because you want to spread it out enough to where the Leukotape does not get on the skin. There's the Leukotape. This is a tape that will take your skin off if you get it on the skin. So the Coverall protects the skin. So we're going to take the Coverall and we're going to measure it out halfway around the leg above the IT band insertion. So we roll it out, measure it out. And like I say, it's good to have some sharp scissors because this is not the easiest tape to cut. And unfortunately, both these tapes are very expensive. The 4-inch Coverall, you can get the 50-yard box and it's about $20 wholesale, and this just lays on the skin, and I don't care if I get a wrinkle here and there because it doesn't matter. It's just there to protect the skin. Now if you can do it, you can tear the Leukotape. It has a cleaner edge. If you don't, you cut it with scissors, but you start it on one side or the other and you pull it tight, taking the slack out of the skin. And I cut it a little bit too long, so I didn't want to get it on the skin, so I tore that off. And we get the next strip, and we go the opposite direction. Once again, this is called redistributing the insertion of the tendon up higher to take the stretch off the tendon where it's inflamed. And you can see the wrinkles in the skin and the tape. This tape can stay on I've put it on skin for up to a month. Ideally, it's 2 or 3 days. You can shower with it. Don't get it wet. Just pat it dry, and it dries readily. If the skin starts getting hot or itchy, take the tape off immediately, pulling the tape close to the skin so you don't rip any skin off with it. But if it gets hot or itchy, you're having a reaction to the tape or the adhesive, and you need to take it off. So it's not real smart to wear this over 3 or 4 days, because after that the skin starts dying away some. And I'm showing the insertion of the tendon right there, usually where the IT band inserts. There's the Leukotape again. There's the Coverall again. We may not always have a table to do stretches on, especially out in the fields. So what I like to do is get her standing up, and we're going to put right over left, perpendicular to the ground, and see how she leans to the side and holds that just like a stretch on the table. And that's the IT band. Thank you very much.